All right, so let's see if this will work out. Sorry about that interruption, Professor Lockett. But this is returning for beginning at the ears and continuing to musculoskeletal, finishing off the full assessment. Pardon me. So the ears, the external ear canal, we checked that. There's no tenderness. The otoscope we're going to check by putting on the appropriate ear thing for their size. You're going to hold it up like this so that you can hold your hand out so that you don't go too far into their ear. Adult, you raise it up to look in. The ear canal is nice and no redness, and the tympanic membrane should be pearly gray. And then for the test for hearing, we do a whisper test where we're 2 feet away and see if he can decipher the 3 things I say. 5B6.
5B6.
And he hears it fine. The Rhine test, which would be with the tuning fork, where we'd hit it and put on the back of the occiput and see when he feels that vibration stop. But those really aren't used too much anymore as testing. Nose, his is midline. There's no deviation. The septum looks straight, looking on it this way. Patency of the nostrils. So I'm going to hold one down and have him blow out. And have the other one down and have them blow out, and those are both patent, they're open. The specula we put right into the nostril and lift up, and that's going to show us the internal nasal mucosa, which should be pink and sometimes moist, I believe. And then the turbinates, which you can assess the first 2 using the specula. This septum, which is the middle, is not deviated. Sometimes if it is deviated, patients might need surgery. And then the turbinates, like I mentioned, are visible as well, the first 2. So moving on to the mouth and throat, the lips are pink and fit his ethnicity color-wise. Checking out the buccal mucosa, you'd use a tongue blade, you'd hold his mouth open, and you can see it right on the inside of his cheek. I'm not going to put my fingers or a pin into his mouth.
Thank you.
And then you'd assess his teeth and his gums. His gums look good. His dentation's good. I'm going to have you stick your tongue out to me, sir. Can you move it side to side? Perfect. Thank you. And then we would look at his hard and soft palate with a light. So open your mouth as much as you can. And his looks good. Good color. Can you say "ah" for me, sir? The uvula goes up. You have a tongue blade that you may be able to, you'd want to try to see if you could get them to gag for that gag reflex. And then as well as the tonsils, which his are a +1. And then another, you can test the tongue by having them repeat after you: light, tight, dynamite.
Light, tight, dynamite.
I like that. So there's symmetry in the neck, no lumps or bumps, and there's no large pulsations. You'd probably be able to feel it if you did. The cervical lymph nodes, and I'm going to try to show you where they are versus standing in front of him and doing it, since that would block your view. So the pre-auricular are right here, post-auricular, occipital, submandibular, submental, submandibular, jugular digastric, superficial cervical, deep cervical, posterior cervical, and then the supraclavicular. I can't say that right now. Pulse, carotid, you feel one at a time. It is rhythmic and sounds good. Trachea is midline, no deviation from that. Range of motion for the neck. I'm going to have him put his chin to your chest, chin to the ceiling. Ear to your shoulder without bending the shoulder, other ear to the shoulder as much as you can. And then can you look one way and look the other. I'm going to have you look that way and don't let me pull your head back. Perfect. Look this way, don't let me push your head forward to test the range of motion and that muscle strength there. At this point, when we're behind the patient to do the the thyroid gland assessment, which you just be standing right behind the patient. You feel kind of that trachea, you feel the thyroid, there's no enlargement. You're not pushing hard, there's no pain there, right, sir?
No.
All right. So then the lungs and chest, we're looking for the thoracic cavity. We're looking for the posterior lateral view to be 2:1, which his is. Proper symmetry to ensure that there's symmetrical expansion. Hold your fingers like this, pinch a thing of skin between it, and when he breathes, it should evenly go out. So I'm going to do that back here. Breath in for me, sir, and out. And one more. Perfect. And that is symmetrical expansion there with good expansion, which is important. We're going to do that tactile fremitus, having him say blue moon, as
Blue
I
moon.
feel
Blue moon,
for that
blue moon, blue moon,
palpable
blue
vibration.
moon, blue moon, blue moon, blue moon.
Good. Thank you. Any lumps or tenderness? I don't see any
No
lumps,
tenderness.
any tenderness when I'm touching you. Okay. And then I check the spinous process. It's nice, straight, midline, no deviation. He has no scoliosis in his history. And I can believe that. Then we have the diaphragmatic expansion. I'm going to have him take a breath in and hold it. I'm going to percuss down. Nope, hold it. And then take a bigger breath in and hold it. Alright, you can breathe. And then you measure that difference, and it should be between, I believe it's 3 to 5 centimeters. That's normal. Yes, 3 to 5 centimeters. And then we would check breath sounds. Looking for to be able to hear the air moving, but
Stop.
not to hear the rails, bronchi, crackles, wheezes, or a stridor. So I'm going to listen to him here. Big breath in and out. Now, in the purpose of saving time, when I come around to the front here, I am going to go ahead and listen for breath sounds. I know we do 5 different spots down the chest bilaterally. I'm just going to do one of the 5 going down. And one more down here. The skin condition is appropriate, his breathing, the chest is expanding, symmetrical. We're going to do that tactile fremitus up here, say blue moon,
Blue moon,
blue moon,
blue moon, blue moon, blue moon, blue moon, blue moon, blue moon,
and you do that
blue moon.
at 4 different sites going down bilaterally. There's no tenderness and no lumps noted. And then the percussion of the lungs, we would do 5 different spots bilaterally. There we go. And then the upper extremities with the left shoulder and the right shoulder. No pain in those joints, sir?
No, ma'am.
Any limitation in your mobility in these joints that
No.
you've noticed? No tenderness, no pain. I'm going to have him do a couple of range of motion activities for me, putting his arms up and breathe out like a woosah. Sorry, that was just a little extra there. That's not really part of it. Can you put both your hands on the back of your head? Perfect. Can you move side to side with that? Good range of motion. All right. I'm going to have you relax those down with checking the elbow. I have his arm relaxed in my hand. I'm feeling the elbow. It's nice and nothing moving around unintentionally in there. Any pain there, sir?
No.
Perfect. And then I'm going to have him do a couple of range of motions, and I check that, of course, on both sides. But the range of motion with your elbow, one up and down. Any pain or limitation to that?
No.
Can you put your hand straight? And can you put it like down on the table, back hand on the table? Down on the table, back hand on the table. Then I'm going to have you kind of make a fist like this, and don't let me pull it out to just test the muscle strength, and that's really good. Wrist and hands, so we're looking for those metacarpals. You feel good. You feel each joint with your pointer finger and thumb. Make sure there's no pain or growth in that. And then can you hold your hand into a fist and not let me move it? Perfect. Now can you do 4 for me? And can you do your all hands up? And can you wave? Good. All right. And then we would check the epitrochanter nodes, which are right in the AC fossa, looking for anything enlarged or actually being able to palpate them. All right. So the breasts on him, obviously being a male, I'm just going to kind of run through it real quick. We're looking for symmetry, the mobility of them, any dimpling, checking the supraclavicle as well as the infraclavical, and checking, palpating it, doing the self-breast exams in 3 different patterns of the up and down, the circular expanding, and then the spoke. Checking the nipple to see if there's any discharge, also making sure that you always check underneath the axilla and that breast tissue that's under there too, as well as the lymph nodes. And those are all really good, important to do for the self-breast exam, just knowing that you do it 3 to 5 days after your period has started and trying to do it every month thus so. Neck muscles, there's no pulsations. I don't see his carotids pulsing. There's no lumps or bumps. When I have him go back to about a 35-degree angle, I do not see any jugular distension there or pulsation. So the heart precordium, I'm going to have patient. I'm going to have you lay down here, my friends. Whoops. So the heart precordium, we're looking for, oh, you know what? No. Yeah. I'm sorry. All right, anyway, looking for the precordium. It is, looks good. There's nothing sticking up. No bumps or indentations. I don't see the apical pulsation, but we can feel that here, especially when he rolls a little bit on his side. There's no heave, which is, or thrill from that heart beating. And that thrill would actually be a palpable vibration that we could feel, which means there's turbulent blood flow in the heart. Heart sounds, we're looking for a lub-dub instead of anything, sounding like a rub, a gallop, any S2 or any S3, S4 notes. So you can just listen to the heart here. Alright, so the abdomen while he's laying down, the contour is symmetrical. There's no big pulsations. A lot of times you can't see the aorta, but I'm not seeing it on his stomach today. The skin characteristics intact, the contour symmetrical. The umbilicus is midline and an innie, which is normal. Like I said, not noticing any pulsation. We're going to check bowel sounds, and when we're checking for bowel sounds, we'll see if we can hear any vascular sounds, which could be a bruit. And his belly's definitely talking to me. I'm going to do percussion of his abdomen, starting in the right quadrant, right lower quadrant, and going up from there. And I don't hear any issues there. Checking for the liver is going to be on the right side, mid-clavicular line, about the 9th and to 11th intercostal space down. You're going to percuss it until you hear the dullness, and then you're going to do that same percussing up here in the abdomen until you hear that go away. And then you can actually test, and the liver should be about 6 to 12 centimeters, which he is. We do the spleen from the left mid-axillary line. And a lot of times that ends up being down to about the 9th and 10th, or 9th and 11th intercostal space. Should not be more than 7 centimeters. Palpation, we put our hand behind the rib cage on the right side. Actually, we do light and deep first, so I'd start in the right quadrant using circular motions. And then I'd follow the same type of palpation with a deeper. Now the liver, you put your hand behind the rib cage. You have your hand like this. You have them take deep breaths and blow it out. And as they blow it out, you advance up underneath there as much as you can. Sometimes you can feel the liver bumping your hand. If you can feel it more than that, then you need to let the doctors know. You shouldn't. Some people you can't feel it at all. The spleen is kind of the same process. Arm reached on the other side, hand like this. While he breathes in and breathes out, I advance up underneath there. Again, this is one that sometimes cannot be palpated as well. Palpating the kidneys if you can. Duckbill on each side, coming in. Same as you can feel. Can't feel anything on that side. And of course, I'd come onto the other side and do the duckbill here to see what we could do. Inguinal area for the femoral pulse, you can feel it right about here. And then you would always assess the inguinal area for the lymph nodes. And you could also include assessment of the inguinal lymph nodes in your male testes or your male genitalia self-teaching test. Alright, so lower extremities, I'm going to have you do spread eagle for me. Or I guess I shouldn't use that expression. I'm going to go ahead and check the muscle resistance here, muscle strength. Don't let me push you back in. Perfect. Legs back in. I want you to do your legs straight up. Perfect. Leg back down. Bend your knee and bring it straight up. Perfect. And back down. I'm going to have you bend your knee, put your foot on the bed here. I'm going to do internal rotation and external rotation. No pain there. And then I'm going to go ahead and do his ankles and feet, checking for mobility in the ankle. And checking in the feet. We already checked the toes a little bit earlier, but make sure you're really checking those metatarsals. And that would be bilateral in the effort of saving time. I'm going to go quite quickly past that. So I'm going to have you pull your foot like up. Don't let me pull it down. So hold it. Perfect. Thank you. All right. Now I'm going to have you sit on the side of the bed, if you don't mind, sir.
Stop. Broadway, take it easy.
Yeah.
Almost done.
Oh, guys, going crazy. All right, so the neurosensation. So I'm going to have you close your eyes. I want you to let me know when you feel sharp, dull. So tell me what you're feeling when you feel it. Okay?
Dull. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull.
All right. And then we would do the light skin test. So close your eyes and let me know when something's touching you.
Don't touch me. So, oh. Don't touch me. Don't touch me. Touching. 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 Touching.
All right. So your sensations are pretty good. And we do the face, arms, and legs for that. The stereognosis. I'm going to have you close your eyes, sir. I'm going to give you something in your hand. I need you to tell me what it is. Oops.
This is a pen.
A pen. Very good. So the cerebellar function, we're going to have him put a finger to my finger and then touch his nose. Good. And then we're going to have him do, while he's setting, heel to shin, heel to shin. Beautiful. All right, and then we're going to do the reflexes. So I'd hold the patient's arm to do the bicep tendon reflex, hold it like this, and hit my finger with the hammer. I'm going to have him relax his arm kind of to the back for the tricep. Hit that. We got the brachial radial, where I'm going to hold his hand, hold his thumb like this, and about 3 to 4 centimeters above that, you're going to test that reflex. Then the patella, you're going to keep a hand up here. You're going to get in that right spot. And then the Achilles, you hold the foot out of flexion and you hit it right behind that medialis, I believe is the name. And you would, of course, be doing these bilaterally and checking those out. Now,
5 minutes.
musculoskeletal, stand up for me, sir. Walk a few steps away. Walk back to me, heel to toe. Walk back to me on your tippy toes. and walk to me on your heels. Perfect. Stand in place, close your eyes. Come a little closer to me just in case you're off of the camera view. Closing his eyes, you want them to close their eyes for 20 seconds to check the equilibrium to see if they start falling one place or another, and that's for the Romberg test. Shallow knee bend on one foot, hop, and then on the other foot, hop. Perfect. Can you touch your toes together? Can you touch your fingers to your toes? And up. Can you bend side to side? Bend backwards. And turn shoulders side to side like that. Ah, that feels good. Alright, then we can have your set back down. The only other thing to do would be the male genitalia next, which we would just check out, make sure there's no lumps, bumps, any pain in those areas. That include the scrotum, penis, testes, and inguinal area. Teaching the self-exam, you'd have them do it. The testes, the timing in the shower, same time every month, using your 2 fingers and your thumb to kind of feel down that egg shape of the testes to make sure there's no additional lumps, bumps, or pain there. And then that would be the end of my physical assessment, head to toe, for physical assessment for the professional nurse. Thank you for my friend here, my husband. Thank you for your time. And thank you, Professor Lockett.